Chapter 1. Setting up and cleaning the RECELL GO processing device. The RECELL GO processing device is a reusable, non-sterile device that should be placed and stored on a clean, flat surface. Ensure the RECELL GO processing device is placed into a clean, flat, and stationary area and plugged into a power socket before use. Switch the device on at the back of the device. Upon a successful self-test, look for the message to display the total number of RECELL GO cartridges used. Once you are ready to proceed, select the green flashing Continue button. Please wait and don't interact with the system while the RECELL GO processing device is preparing itself for the session. When ready, the screen will display the message, "Please clean." To clean the RECELL GO processing device, select the flashing orange Clean button. Wait for the Wipe Clean display and for the shaft to lower before the device is ready for cleaning. Wipe the equipment with non-woven towelettes containing surface agents that are non-abrasive, non-corrosive, and safe for all non-porous surfaces. Wipe the entire interior and exterior of the device, including, but not limited to, the inner chamber, the shaft, which extends from the top of the inner chamber, the LCD screen, buttons, the door, and hinges. Pay attention to areas such as crevices, seams, fluid spillage, and stained areas. After cleaning is completed, press the flashing green Done button and notice as the shaft retracts back up. The display will now prompt you to move to the next step and prepare the RECELL GO cartridge. Preparing the RECELL GO cartridge. Once you have set up and cleaned the RECELL GO processing device, you can step away from the device and prepare the RECELL GO cartridge with the RECELL enzyme, buffer, and skin for processing. As you begin to unpack the RECELL GO preparation kit, take notice of the expiration date on the outer shelf box. Do not use beyond the stated expiration date. Open the RECELL GO preparation kit and place the procedure guide in a non-sterile area. Place the RECELL GO accessory pack, which includes the pouched RECELL enzyme, Procedure Pack A, and Procedure Pack B in a non-sterile area. You will also see the RECELL GO cartridge tray. Once you have put these items in a non-sterile area, the outer shell box may be discarded. Remove the lid from the RECELL GO cartridge tray and aseptically transfer the RECELL GO cartridge and RECELL GO disaggregation head onto a sterile draped procedure table. Be sure to check the underside of the RECELL GO cartridge to ensure proper alignment and that the pins are centered. In the non-sterile work area, remove all the components from the accessories pack and procedure packs A and B. Place them on the clean table. You should have the following items in the non-sterile work area. Additional items we recommend you have available are drape, gauze, saline, blunt forceps, a ruler, marker, and non-woven towelettes. We also suggest you keep the included procedure guide nearby for easy reference. Start by reconstituting the RECELL enzyme. In the non-sterile work area, remove the RECELL enzyme from the pouch. Remove the cover from the vial marked enzyme to expose the injection diaphragm. The diaphragm of the enzyme vial may be wiped with a sterile alcohol wipe and allowed to dry. However, this step is optional. Remove the cover from the vial marked sterile water. Connect a sterile blunt fill needle to a sterile 10 milliliter syringe and draw up the entire volume of sterile water. Inject the entire volume of sterile water into the enzyme vial. Do not use buffer at this stage, as this may inhibit the enzyme action. Mix gently until dissolved. Do not shake. Use care to avoid foaming. Draw the enzyme back into the syringe. Using aseptic technique, dispense the entire volume of enzyme into well A. Discard syringe and needle. Using aseptic technique, introduce one blunt fill needle and one 10 milliliter syringe into the sterile field. In the non-sterile preparation area, remove the cover from the 10 milliliter buffer vial. The diaphragm of the buffer vial may be wiped with a sterile alcohol wipe and allowed to dry. However, this step is optional. In the sterile area, attach the sterile needle to the clean 10 milliliter syringe. In the non-sterile area, hold the buffer vial to allow for the volume to be drawn up by the person in the sterile field. Draw up the entire volume of buffer, which is approximately 10 milliliters, from the vial being held by the person in the non-sterile area. Dispense the entire volume of buffer into well B of the RECELL GO cartridge. Next, refer to Table 1 in the provided procedure guide to determine the appropriate volume of buffer required for the amount of skin to be processed. Use the same 10 milliliter syringe and needle to draw up the relevant volume of buffer from the 30 milliliter vial being held by the person in the non-sterile area. Dispense buffer into well C of the RECELL GO cartridge. You may now introduce all of the remaining accessories and items from Procedure Pack A and B to the sterile field, which includes 6 10 milliliter syringes, 4 spray nozzles, 6 blunt fill needles, and 1 scalpel. At this point, the skin sample can be harvested. Chapter 3: Harvesting and adding donor skin to the RECELL GO cartridge. The donor site should be clean and of appropriate depth and show no evidence of surrounding inflammation or infection. If desired, infiltrate the subcutaneous tissue with a tumescent solution of choice. Using a dermatome, harvest a thin skin graft at 6/1000ths to 8/1000ths of an inch, or 0.15 to 0.20 millimeters. Refer to Table 1 for the appropriate sizes to harvest based on the treatment area. RECELL GO can also be used to process small skin samples down to 4 square centimeters for smaller wounds. A maximum of 24 square centimeters can be placed in well A and processed at one time. Use the scalpel provided in Section A to cut the skin sample into pieces no larger than 3 centimeters by 2 centimeters. Next, place the individual donor skin samples into well A. Ensure that you place the pieces separately from each other in different quadrants of well A. It does not matter which side of the skin is placed facing up. Use blunt forceps to spread out the skin along the base of well A. Do not use pointed forceps so as not to pierce the filter in well A. Then, place the RECELL GO disaggregation head on top of the skin sample in well A. Once the RECELL GO cartridge is prepared, press the flashing green Continue button. Chapter 4. RECELL Spray-On Skin Cells Processing. Once you have verified the contents of the RECELL GO cartridge, press the flashing green Continue button. A non-sterile assistant should open the door of the RECELL GO processing device. While maintaining aseptic technique, keep the RECELL GO cartridge level and slide it into the RECELL GO processing device until the side tabs on the cartridge meet the device. A non-sterile assistant should then close the door and press the flashing green Start button to start the skin processing sequence. The buttons will cease flashing and the screen will count down until the RECELL Spray-On skin cells are ready for collection. If the RECELL GO cartridge is not properly detected, refer to the troubleshooting section in the instructions for use. The entire process will take 35 minutes. The shaft will descend and lock the disaggregation head in place. Skin processing starts once the RECELL enzyme in well A is heated to the appropriate temperature. The skin will be repeatedly immersed in the RECELL enzyme in well A for about 25 minutes. After about 25 minutes, the cartridge wells will rotate, moving the skin out of the RECELL enzyme and into well B, where it will be immersed in the rinse buffer. This step will take only a few minutes. Once the skin has been rinsed, the cartridge wells will again rotate, and the skin will be immersed in the suspension buffer in well C and mechanically disaggregated. When the process is complete, the shaft will ascend and disengage from the cartridge. An audible alert will sound, and the screen will display Process Complete. Aseptically draw up the RECELL Spray-On skin cells. The RECELL Spray-On skin cells are now ready to be drawn aseptically from well D. Extraction and application of RECELL Spray-On skin cells. When the process is complete, an audible alert will sound, and the screen will display Process Complete. Aseptically draw up the RECELL Spray-On skin cells from well D. The RECELL Spray-On skin cells are now ready to be drawn aseptically from well D. A non-sterile assistant should open the door of the RECELL GO processing device and move the RECELL GO cartridge forward on the base of the device until well D is accessible using aseptic technique. The RECELL GO cartridge can also be placed in a clean area next to the RECELL GO processing device if desired. Locate the blunt fill needles and syringes in the sterile draped procedure field. Attach a blunt tip needle to the 10 milliliter syringe. Return to the RECELL GO cartridge, noting the outside of the cartridge is no longer sterile. Using aseptic technique, seat the needle in the dimple at the base of well D. Mix the cell suspension by drawing up and returning back to well D. Draw up the required volume to apply to the treatment area, using the additional syringes and needles provided as required. For spray application with the nozzle, you must have at least 2 milliliters of cell suspension in the syringe. Connect the nozzle to the syringe and check that the spray nozzle faces the wound. Hold approximately 10 centimeters from the most elevated point of the wound and spray evenly across the wound. When applying less than 2 milliliters of cell suspension, do not remove the needle from the syringe. Starting from the most elevated aspect of the wound, drip cells onto the wound. Apply primary dressings and secondary dressings. Secure dressings with outer bandages. For aftercare instructions, refer to the RECELL system, aftercare instructions for the healthcare professional. Chapter 6. Reusing the RECELL GO processing device. Once the procedure is complete, remove the RECELL GO cartridge and dispose per your facility protocol. After pressing the flashing green Continue button, the screen will display, "Please clean." It is highly recommended to clean the RECELL GO processing device after retrieving from storage and in between uses as part of regular maintenance. Refer to Chapter 1 of the video and the instructions for use for more detailed cleaning instructions. The RECELL GO processing device may be used for up to 200 uses with separate single-use RECELL GO cartridges. The device screen will indicate the number of RECELL GO cartridges used and alert you when the device is within 10% of reaching this limit. It is recommended that you contact your AVITA Medical representative at that point to discuss the appropriate time to replace your RECELL GO processing device to ensure uninterrupted patient care. It is important to remember that your RECELL GO processing device will not prepare any RECELL GO cartridges beyond the 200 cartridge limit. Once 200 cartridges have been reached, the RECELL GO processing device must be replaced to maintain effective cell harvesting.